On August 15, 2025, major Ohio government actions included the Ohio Department of Job and Family Services, ODJFS, launching the In-Demand Jobs Survey, targeted at small business owners to gather input on the state's in-demand jobs list, which guides the allocation of 85% of Federal Workforce Innovation and Opportunity Act WIOA training funds. This survey aims to ensure workforce programs meet employers' needs, with the DeWine administration continuing efforts started in 2019 to streamline employer feedback processes. Concurrently, at the federal level impacting Ohio, the National Institutes of Health, NIH, halted research initiatives focusing on health disparities. This reflects the federal government's ongoing policy shift away from diversity, equity, and inclusion (DEI) programs, as mandated by recent executive orders. The NIH is redirecting funding towards supporting vulnerable populations based on clinical need, rather than identity categories, following criticism of DEI initiatives as ineffective or politically divisive. Ohio state government actions recently included Governor Mike DeWine's signing of House Bill 96, HB 96, on June 30, 2025, overhauling affirmative action requirements for state contractors. Effective September 30, 2025, the law removes mandates requiring state contractors to maintain and report affirmative action programs and prohibits public authorities from disqualifying bidders for non-compliance with affirmative action or DEI programs. This aligns Ohio with the Trump administration's federal rollback of affirmative action policies. 1. No specific enforcement actions on August 15, 2025 were reported in the search results. However, Serve Ohio reported funding opportunities linked to the Make a Difference Day 2025 project earlier in August, supporting community service efforts, though no events specific to August 15 were detailed. 4. Summarized, Ohio Department of Job and Family Services launched the In-Demand Jobs Survey on August 15, soliciting small business input to update the state's job priority list, guiding training fund allocation. 3. NIH ceased federal health disparities research due to policy shifts against DEI mandates, affecting federally funded initiatives that Ohio institutions would be part of. 5. Ohio's HB 96, signed June 30th, eliminates affirmative action requirements for state contractors, with changes becoming effective September 30th, 2025, impacting public contracting and procurement. 1. Serve Ohio announced funding for volunteer projects connected to Make a Difference Day 2025 earlier in August, but without specific events on August 15. 4. Agencies involved include the Ohio Department of Job and Family Services, Ohio Governor's Office, DeWine, National Institutes of Health, and Serve Ohio. Key officials referenced are Governor Mike DeWine and unnamed NIH and Health and Human Services spokespersons. Relevant legislation is HB 96, removing affirmative action mandates in state contracting. 1, 3, 5.